Thanks so much for volunteering to be one of our screeners at the Fry Tower 352 West 10th Avenue entrance. I'm going to review a couple of procedural issues to go through the preparation of getting ready for screening, going through the screening process, and handling some of the materials. So the first thing you want to do, whether you're the first person of the day or you're coming in relieving another shift, is so you're going to want to clean the area. So we've got sanitizing wipes here. You're definitely going to want to put gloves on prior to using these sanitizing wipes. These are heavy disinfectants that can sometimes cause irritation to your skin. We have small, medium, and large gloves down here to the bottom left of the table. So get a size of glove that fits best for you, unravel the wipe, clean the entire surface of the entrance table, including your hand sanitizer pump, the Kleenex box, sanitizer canister, your Sharpie box, your supplies here, including your handheld thermometer, and your Sharpie. Once you have properly sanitized your area, you're going to want to make sure that you have plenty of supplies to get through your shift. As you've seen a number of these, the level 1 masks, you have paper bags here, Kleenex, hand sanitizer, the sanitizer wipes, backup batteries, and a backup thermometer for your temperature screening. You should also have your cell phone on you so that you don't leave your station in case you can call somebody if you run out of supplies or encounter any difficulties. The next thing that you need to do is, before screening any individuals, is change out of your own facial mask into an N95 respirator, which is a requirement for all of our screening volunteers. So I'm going to demonstrate how to properly doff your PPE, which is the technical term for removing your mask. So I'm going to take off my level 1 surgical mask here. We'd like to get multiple uses out of our mask to preserve our PPE. So that's what the paper bags are for. I'm going to write my name on the paper bag. And when I doff my level 1 mask, you want to make sure that you're by yourself inside the vestibule so that you don't share any respiratory droplets with anyone. To properly doff your mask, you want to grab them by the ear loops only. You never want to try to minimize any touching of the mask particles itself, or the mask portion itself. So grab the ear loop. You're going to take it off on one, take it off on the other, grab it by the loops, fold it in the middle. Make sure the inside especially never gets touched. And you want to lay it flat inside this bag. So for people that are going to reuse a level 1 mask, faculty, staff, and students should store this in your office, consult room, or locker. And anytime that it is visibly soiled, torn, or in disrepair, please ask for another one, but we'd like for you to get at least a couple of uses out of it to try to preserve our PPE. Now we're going to teach you how to don your N95 respirator. This gives you an extra layer of protection since some outside individuals might be coming in without wearing a mask. So I'm going to show you how to properly doff this or don this. It's easy. Since this fits a little tighter and it fits over your head, I would recommend taking your glasses off first. Try not to touch the inside of the respirator. You want to lift this out of your way, the bottom strap, place it on your chin, pull it up and over, and put it behind your head, below your ears. Then place this over your nose, pull this up over your head in front of your ears, and then you want to pinch it securely with the metal strip to secure it over your nose so that if you're a glasses wearer, it will prevent some anti-fog. It'll prevent fogging of your glasses. Once your N95 is properly in place, you're able to screen your patients. So faculty, staff, and students will card swipe in. Morning, Dr. Willie.
Hello.
Thanks for showing me your ID. So I need to ask you, I need to check your temperature here.
Okay.
So if your brow is, have any sweat on your brow, you can use you can dab it there and move your bangs out of the way if need be. And you just hold this, you just turn it on to get the light there. Hold it 2 inches away, use one little button, and you get a reading right there. Any reading of below 100 allows them to continue on to the health screening question, which is, have you had any new symptoms of fever, chills, cough, loss of taste or smell, or any flu-like symptoms in the last 5 days?
I have not.
Great. So we're gonna allow you to be able to enter the building today. I'm gonna ask you to sanitize your hands, please. We will have stickers we're using a Post-it note today, but we will have stickers that we will write the date of entry on. So I'm going to give you this sticker for you to wear visibly on your shirt the whole time you're in the building. If you need to leave the building and come back in on the same day, you don't need to be screened. We'll just let you pass right on through.
Okay.
Are you seeing patients today?
I am.
You are. So you're going to need a level 1 surgical mask when you're seeing patients. So let me give you one of those. Can fold that so that the white part goes towards your face, and you want to kind of fold that to keep that preserved. Do you have a paper bag to store that in?
I don't have one yet.
So let me give that to you here. So that's to store it in your office or consult room or locker to reuse. Try to get a couple of days worth of wear out of it.
Okay.
Okay.
Do I need gloves for patient care?
The only time you need gloves is if you're actually going to do direct skin-to-skin contact with a patient or a research subject. In that instance, the gloves that you will use will be in the research room, the exam room, the consult room, or in some of the staff work areas.
Okay.
Okay. Have a good day.
All right. Thank you.
Thanks again for volunteering your time to help keep our facility safe and healthy.